¿Qué tal? Bienvenidos. Welcome to Running Records Podcast. Today I have a very special guest, Doctora Grecia Rojas. Welcome to the show.
Thank you, Lawrence. I'm so excited to be here.
How are you this afternoon in this beautiful weather in Houston, Texas?
I am doing amazing, and the weather has been really, really good. We are enjoying these only weeks, probably the nice weather.
We were talking about the weather, the hot weather, the humid weather, cold weather. What's your type of weather? What do you like?
My type of weather is sunny and 75. If I could have it like this all the time, it'd be amazing.
You say you're from El Nuevo Laredo, El Paso,
Laredo.
Laredo, Texas.
Yes.
Laredo, Texas.
Laredo, Texas.
How is the weather different from Laredo to Houston?
Oh my goodness. So Laredo is more dry.
Uh-huh.
Houston is humid, which
Yes.
which you like.
I love that. Yes.
But yeah, Laredo is very, very dry. I actually remember running. So I was in track back in the day, right? And I remember running the hills of Laredo in the hot, like 110-degree weather.
Yeah, those high school years. My coach used to tell us to go run after school. Exactly at 3 p.m. when the hot, humid weather was like
Mhm.
super hot.
Yep.
But that was part of high school. That was part of running at that time.
Yeah, and back in the day, you're like, oh, this isn't that bad.
Uh-huh.
But
Yeah.
then you get older.
That's a different story. That's a different story. Doctora, can you let's start with your social media. How can we find you on Instagram, on TikTok?
Yeah, so I'm in all of them as the Crunchy Chiro. So the Crunchy, it has two sides to it. So Crunchy because I'm a chiropractor, right? We adjust, and also Crunchy means holistic, so organic, everything that you want to do with non-GMO, so stuff like that. Very into holistic side.
I remember the first time that I decided to go to a chiropractor was because I was training for the Chevron Houston Marathon for 2024. So,
Hmm.
I wanted to get better. I wanted to be a better runner.
Yeah.
And I remember I saw one of your videos doing those crunchy sounds.
Yeah.
And I'm
The
like,
adjustment.
I need to go to one of those places for an adjustment.
Yeah.
And then I that's how I met you. So I think it was at the beginning, at the middle of 2023.
Hmm.
2023. So, Doctor, can you tell us a little bit about your story? Where are you from? Where did you go to school? And why did you become a chiropractor?
Yeah. So, I'm a corrective chiropractor. So, what that means is I take x rays, and based on those x rays, I remove misalignments, not just in your spine, but for runners in general. We have a lot of misalignments in the pelvis. So, whenever you're hitting the pavement, your one side is hitting before the other one. So that's what I see a lot of runners, also in the low back and the ankles. What a lot of people don't know is that we also can adjust knees, ankles, shoulders, just making sure that you're working as optimally as possible. And then I went to school in, it's called Texas Chiropractic College, and that's why I moved here. And that is in Pasadena.
In Pasadena.
Hmm.
I believe that in order, for runners to become better runners, to have a better form, we always are looking for different, tips, different techniques, different factors for us to become better runners.
Yeah.
Why do you think it's important for runners to go to a chiropractor, to have a chiropractor?
Oh my goodness. Well, one, it's important for everyone, right?
Yeah.
But especially for runners, because you guys put a lot of, pressure on your body. It's not about the pressure on the joints, but it's about improper form putting pressure on the joints, right? So there's, I believe in what's called prehab. So before you get into an injury, which, everybody knows rehab, prehab, make sure that your body is better able to not have those injuries before, right? So there's a reason why, Tom Brady has a chiropractor, Usain Bolt, Michael Phelps, because we want to make sure that your body is functioning the best possible so we don't have those injuries and we don't have to go through that.
What are the best
Hmm.
and worst supplements for runners?
So there's a big one is omegas, right? So for any kind of inflammation,
Hmm.
magnesium. A lot of people just are deficient in magnesium in general, but magnesium specifically for runners makes sure that your muscles are working as optimally as possible, and helps with endurance as well. Creatine is a big one, and then of course collagen and vitamin C. Together, they are great for joint health and collagen, and just making sure that you decrease the risk of injury.
Okay, I know that I have at my house. I have a magnesium,
Hmm.
I have collagen, and I have a vitamin B12.
Which is great for energy. Hmm.
And some other supplements. But it's always great to know what other supplements can you get additionally if you're a runner or if you're doing any type of exercise. So it's always great to go to a professional and they can tell you, okay, you need this, you need that. Where can you buy this?
Yeah.
Where will be a good place to get these supplements?
So the thing that you do, I recommend for all my patients is making sure that they one have the right dosage, and two have the making sure that they don't have anything as far as fillers, right? Because a lot of supplements now have fillers,
Mhm.
and they're not actually making the changes that you want. So for instance, you can go to Costco, you can go to Walmart, and they have like 120 capsules for $20.
Mhm.
But then you have to think about what are the fillers that are in there. Is it really actually making a change in my body that I
Yes.
want? So if you buy a supplement at a physician's office, right, like our office,
Mhm.
they're going to be a lot better quality than the ones that you're going to get. And then again, you can buy the one at Walmart, but make sure that the dosage is high enough to actually make those changes. So sometimes you got to take 20 of them to get the same thing as a physician's office.
That's true. That's true. Right now we are in running season. I don't know if you've seen a lot of running clubs in the community.
Hmm.
We've seen a lot of races. So every time that there is a race, there is a marathon, there is a half marathon, I'm pretty sure that a runner always comes to your office and tells you, "Oh, I'm injured, my knees."
Yeah.
Or what is the most common injury that you see after a race, after somebody runs a marathon?
Plantar fasciitis is a big one.
Uh-huh.
Shin splints, right? So that's weak tibialis anterior. We can talk about like glute bridges, making sure that the posterior chain is nice and strengthened as well. But the biggest injury I probably see is shin splints.
Shin
Yeah.
splints.
Hmm.
What is the main cause of shin splints? Because I only had shin splints one in my whole life running,
Hmm.
and I've been running for, I don't know, like running marathons and have marathons maybe for more than 12 years. And last year, when I was training for the Chevron Houston Marathon, I got shin splints for the first time. And the first week, I was like, this is gonna pass. It's gonna last maybe 2 weeks. So I went back to running again,
Hmm.
and then it got worse. And I was like, oh my goodness, what's gonna happen with my marathon? Why do people get shin splints? What can we do to avoid shin splints?
Yeah. So one, make sure that you have proper alignment,
Mhm.
because if you don't, I mean, there's a reason why there's one side that is affected and the other one isn't, right? So that's number one. Number two, that proper alignment is important, is making sure that the brain sends signals down the spinal cord to, so there's fast twitch muscle fibers or slow twitch muscle fibers. So even that can, if there's interference there, can make that muscle not function as properly. So that's what I was talking about, a weak tibialis anterior, right? That's what most people don't know too.
Mhm.
And then another one is making sure that the musculature around is nice and strong, so it's able to support those long distance, the marathons, even the 5Ks that
Mhm.
people do in the weekends. In order to support all that, we need to make sure that all of that is nice and strong.
Yes, and also before a race, I will say that this stretching part, the stretching before the race, even if
Mhm.
it's a 5K, even if it's a 10K, if it's a short distance, Some people don't do that part, like stretch. They just like run, and like,
Yes.
man, you're gonna injure yourself.
Yeah, absolutely. So the stretches, and I see a lot of people do slow stretches. I'm like, no, you need to create that, that mobility in everything, in your joints. And then again, for you to have a long career, because you can just do it cold, but it increases your risk of injury a lot.
Is it true that during that we as we get older, our knees, they become less stable, and our form is in bad shape? So is it true that as we get older, and runners, get older,
Yeah.
is it true that knees also get damaged?
So here's the thing. As you get old, it's not as you get older,
Uh-huh.
is the more that we use it with improper alignment. Because I have patients that are 90 some, right?
Mhm.
And they're doing great. I had a patient just last week tell me that she actually fell after a movie. She went to the movie theater, she fell, and she got right up. Most 90-year-olds do not do that, right? So that's why it's so important. But as far as, like, let's say knees or hips, again, if you are putting more pressure on one side over the other, that creates more risk for hip replacements, knee replacements, more degeneration. But again, things that you can do, we want you guys to be moving. We want you guys to be running. It's not stopping that. It's making sure that you're doing what you can. Just like changing the oil in your car, right? We're not just gonna run the tires or run the car the whole life, right? Without changing the oil, without changing the tires. That's the same thing with the body.
I remember that when I started going to the chiropractor, I used to go 4 times per month.
Hmm.
But as I progress and as I got better, now I just go 2 times,
Yeah.
2 times per month. How often do people or the runners need an alignment? How often do they need to go to the chiropractor once they start going for their therapy? Will you call it a therapy?
Yeah, so it depends. Everybody's different, right?
Mhm.
So that's why we take X-rays before we even touch you, right? So what I would say is what you did was corrective care, right?
Mhm.
So you came in, you had the misalignments that you had, right? Your health goals as well. That
Mhm.
that's a big one because not everybody is going to be an endurance runner, a long distance runner, right?
Mhm.
So if your health goals are not that, then we're going to see you less often,
Yeah.
right? And it's not because people ask me all the time, do I need to go to a chiropractor forever?
Mhm.
And it's like, it depends on how long you want to be functioning
Yes.
properly, right?
Uh-huh.
So what happens is depending on your health goals, depending on your x-rays, depending on, your exam, we see exactly what that person needs. And sometimes they need a little bit more in the beginning. And then once their body is stable enough to hold it, then we can bring them down. And that's all they need. Basically, what they need is maintenance, just maintaining.
Yeah, maintenance, 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 maintenance. It's
Hmm.
like a car, like you said. Because if we stop going to a chiropractor, then things can go back to the same way they were. So it's just maintaining.
Right. Because
Mhm.
we're still going to go through life, right? We can't keep you guys in a bubble as much as we can would want to, right?
Yeah.
So you're going to keep sitting at your desk, or you're going to keep looking down on your phone, or you're going to keep, having to drive long distance here in Houston, right? Like at least an hour in traffic going anywhere. So because you're going to keep doing that, and our bodies weren't made for that, right? Our bodies back in the caveman ages, we ran and we, hunted and we did all these things.
Yeah.
And now we are very, technologically advanced.
Mhm.
So because of that, more and more people need chiropractors in general.
Yeah, I think everyone needs a chiropractor. Even if you're not a runner, everyone needs a chiropractor because when you're working at their office, you're sitting, you're going for a lot of stress, things like that. And I think yeah, everyone needs a chiropractor, and just keep going for maintenance and everything. What is your favorite park in the city of Houston to go just for a walk, for a jog, to run? There's Memorial Park. Which one is your favorite?
Oof, Buffalo Bayou
Hmm.
probably is my favorite. It's so pretty. It's so pretty, and then even if the weather is hot and humid, which I don't like, it doesn't feel like it because it's so open.
Yes. Yeah, the Buffalo Bayou is one of my favorite. It's I think one of my top three. Buffalo Bayou, Herman Park, and
Yes.
I think Memorial.
Yeah.
Memorial. But I don't know. There is something about the Buffalo Bayou. Like you can just go run and see different things. Do you have like dogs, pets?
Yes.
Uh huh.
Yes, I do. I have one dog. His name is Bourbon.
Uh huh. Is he a runner?
He is not a runner. As much as I try to make him a runner, Lawrence,
Uh
he
huh.
he will not. He is a big lazy boy.
Okay. Oh man, what breed is your dog?
He's a rescue, so he's
Okay,
a Labrador Husky.
Labrador Husky.
Hmm.
Okay, okay. Those are runners. Those.
Yes, you
Uh-huh.
would think.
Yeah.
That's why we got him.
Like, he's not. He's not. Yeah. Maybe it's the humidity in Houston. I don't know.
Yes, that's probably what it is. His husky side won't let him go outside.
Oh my goodness. I don't have a dog, but I always wanted a Doberman.
Yeah.
A Doberman, but since I don't have the space, I'm just waiting, to have that big space, and that way I can have a big dog. That way he can run around and everything.
Yes.
But
They
yeah,
seem like good runners.
yeah, they're runners. They're good runners, Dobermans. If you don't take them out to go for a run, they get a lot of anxiety, and that's when they start doing a lot of crazy stuff
Just
out there.
mischief, yeah.
Yeah. Another question that I have: can a chiropractor fix a bad running form?
Yes,
Mm-hmm.
absolutely, absolutely. So from the head to the toes, right?
Mm-hmm.
So we see what kind of alignment you have in your feet first, right? Like supination, pronation. How are the feet? Because again, we can adjust the ankles for that. And then we go on to the knees, and then we go on to the hips, and then the pelvis, and then the lumbar, which is the low back, and all of that. So running form is one of the most important things for longevity as a runner, if
Mm-hmm.
anything.
Yes. Again, I'm gonna tell my story.
Yeah.
But when I was, going to the chiropractor, I was running. I think one more. My body was going more. I don't remember. I was going to the left side or to the right side. But once I started going to the chiropractor, um, I remember that one of my problems was the angle on my hip was a
Mhm.
little bit lower.
Yeah.
So once we fixed that, I noticed the difference when I was running. I was like, man, this actually works.
Yes, and you can be faster.
Mhm.
You can last longer as well. And just even I remember you in the beginning, even you like going forward, anterior head posture, it helps open up your lungs, right? Because
Yes.
your lungs are in the rib cage, so you have even more VO2 capacity, right?
Yes. Yeah. Absolutely. Absolutely. In the city of Houston, there is a lot of options to go for food. What is your type of favorite food to go in the city? What's your favorite food?
Well, I used to be a really big foodie.
Uh
I
huh.
used to go to me and my fiance.
Uh huh.
We had a date night every week, and every week we would go to somewhere different.
Okay.
I specifically love, well, obviously Mexican food,
Uh huh.
but we love to go to Chinatown as well.
Okay.
Korean barbecue,
Yes.
love Korean barbecue. But now again on the crunchy side or holistic side,
Uh-huh.
as of maybe a year or two ago. Right now, I love Bella Green,
Okay.
Ruggles Black. They
Mhm.
have really good organic food as
Uh-huh.
well. That's like grass fed and everything. And it's good.
Pretty good. I'm gonna try. There is a place here in Chinatown that I always go for my banh mi sandwich.
Oh yeah, yeah, yeah.
Those are
Love banh mi's. Yeah.
yes. The first time that I tried them, I was like, I'm gonna try a sandwich because I always been like a guy that likes torta sandwich.
Hmm.
So I was like, let me try something different, Vietnamese, and I tried the Lee sandwich,
Yeah.
the ones on I think Bel Air and Hill, no Wilcrest, no Boone, somewhere there in Chinatown.
Yeah, yeah, yeah.
Those are delicious.
And I didn't know they were duck at first.
Uh
I was
huh.
like, oh, this chicken tastes different.
Yeah. Yeah, there is a lot of good places on Chinatown for sandwich, for ramen, for different types of food that you like. Another question for you, doctor. Chiropractic versus ibuprofen. Which wins for
Oh
runners?
my goodness. Well, ibuprofen is a band-aid, right? I
Uh-huh.
mean, you can. But I will say too, the more that you take, because if you take one ibuprofen, it's okay, right? Once in a while.
Mhm.
But if you keep taking it for long periods of time, it does build up in your body, right? It does build
Uh-huh.
up in your body, and it could cause things like digestive issues, even stomach ulcers. So we want to make sure that we don't depend on it more than anything. Now, as far as chiropractic or corrective chiropractic, it makes sure that we don't get to the ibuprofen in the first place. And, let's say it's after a marathon, then um, come get adjusted right away to decrease the inflammation, to make sure that, your body is just better able to recover as well.
Yes, yes. Sometimes, like for example, headaches.
Hmm.
For headaches, I always prefer to wait for my chiropractic
Yeah.
adjustment and not take an aspirin. If it's not that worse, that bad, I'll just rather just go for a run, go for an adjustment, or just yeah, those are the main things that I do. But I rather sometimes, I'll prefer stay away from those pills.
Yeah, absolutely. And a lot of people don't know that chiropractic adjustments can help with headaches too,
Hmm.
even, right? Because 80% of headaches actually come from the neck.
Yes, yeah, and yeah, and just an adjustment, an alignment, it can help. It can help a lot. So, what's one of the tips, for example, that you can give to all the running community when they're using their phones? Most of the people, when we're reading, we're checking out our Instagram, we put our head down. Is
Hmm.
which tip would you give to a running community when they're holding their phone for not to, make these words the back?
Yeah, yeah. So what I would say is you are not a slave to your phone,
Uh-huh.
right? Your phone was made for you.
Yeah.
So we want to make sure this is what I do.
Hmm.
I specifically, whenever my arm gets tired, because sometimes I have to remind myself, right? I'm not perfect. No one
Yes.
is. So I have to remind myself, hey, you are a chiropractor. You know what this does to your spinal cord and your nervous system. So I hold it here and I bring it to me.
Okay. Do chiropractors go to a chiropractic?
Yeah.
Yes.
Yes, we have to. So I'm lucky enough that I work with three other chiropractors that can adjust me. I actually get adjusted twice a day.
Oh, twice a day?
Twice a day.
Wow.
Yeah, because of what we do throughout the day, right? So we're adjusting a lot of people, we're moving our bodies, we're jumping on people, right? So all of that creates misalignments in our spine.
Mhm.
And, just like athletes, we want to
Yes.
make sure that we're functioning and our careers as long as possible. So we can't get injured either. So that's why I get adjusted twice a day.
Oh my goodness. Wow, that's pretty good. That's pretty good. Twice a day. Hey, doctor, are foam rollers overrated or essential?
I think they're essential.
They're essential?
Yeah, I
Uh-huh.
think I think they're essential for recovery for sure. Like we talked about shin splints, right? So we
Mhm.
can foam roll our tibialis anterior.
Mhm.
We can be foam rolling just our entire legs. And there's vibrocussors as well,
Mhm.
so that really helps it just be a lot faster.
Yeah.
They're a little bit more expensive than foam rollers, but foam rollers just work just fine.
So if a runner needs to buy, a tool after a run, or just a tool that they can have at their house, which one will you recommend that a runner should buy besides a foam roller?
So a vibrocussor, it's like a hyper ice or those massage guns
Uh-huh.
are really really helpful, especially for like IT bands as well.
Uh-huh.
So in order for that's another big one that people come into the clinic for, right? Like IT band syndrome.
Yeah.
So that has to do with like weak glutes
Okay.
as well. So pro tip.
I actually have a massage gun, but I no, I don't use that often
Hmm.
because sometimes it's super hard. So
Yeah.
I need to like actually just use it whenever I feel some pain. But are they? Do they work or? I'm pretty sure they work, but there is a right way to use them, right?
Yes,
Mhm.
absolutely. So what I see people make mistakes with is they'll use it on the bone. and that's a big no-no, right?
Uh-huh.
Or they'll try to work it around their knee. So always stay away from the bone, always stay away from the joints, but big muscle bellies. Go
Okay.
to big muscle bellies, and then there's massage guns that have different intensity levels, so low, medium, high. You know, if you do feel like it's a lot, there's a lot of sensitivity. That probably means that you need it as well, right?
Uh-huh.
So there's inflammation there.
The massage gun that, well, is a massage gun the one that you have at your office, or that's something different from the back?
Oh, that yeah. So that's something different. So that what you're talking about is an arthrostem.
Uh-huh.
So massage gun is just for the muscles, and then the arthrostem is there to it actually adjusts. So it can break someone's bone if you don't use it right. So only professionals should do that.
Oh, okay, yeah. See, that's why I don't use the massage gun that often, because
Yeah.
I know I can break my bones. Also. Another question: what's the ultimate recovery routine for runners that you will say?
So contrast, right? So first contrast with temperature. So ice and heat. Doesn't matter the order. I specifically like to do a cold plunge, or I go to what's called Restore Hyper Wellness. So I'll do like cryotherapy, and
Okay.
then right after I'll do the infrared sauna. So that's a big one. Making sure that you have the right electrolytes. So what a lot of people do wrong is they'll take lots of water, but they don't focus on electrolytes. And you can do this very cheaply. So like I'll do Baja sea salt,
Uh-huh.
or golden. I think it's called golden sea salt.
Uh-huh.
So I'll use that before runs as well. Again, in Houston, it's really hot, so we want to make sure that we don't just drink lots of water, but also get our electrolytes in. And we want to make sure that we are stretching after.
Yes. Yeah. Yeah. Very, very important. Very important stretching after and taking care of yourself. Doctor, growing up in a Mexican family,
Mhm.
my father always used pomadas
Yeah.
and things like that from Mexico. Um, do they work? Do they actually work? Like when you put those gels, esas pomadas, do they work? Do they have an effect on your body, or is just like the idea that they can help you to remove the pain?
Well, it depends on the pomada, right?
Uh-huh.
It depends on the lotion or potion, right?
Yeah.
But there's some with arnica. The
Uh-huh.
the ones with arnica are really good, and they're more natural as
Yeah.
well. We also want to make sure that they don't have like added chemicals, or are just doing a little bit more harm than they are good.
Okay. Okay. There is one that my girlfriend brought me from Mexico.
Mhm.
It's called marijuanon,
Oh,
and I
okay.
I think it
Oh, it's
has
like CBD. Oh, CBD is really,
CBD.
really good too.
Uh-huh.
Yes.
CBD is also good.
Yes.
Uh-huh. Okay, okay, yeah. See, this is great to know for all our running community, because sometimes we try and we use different things,
Yeah.
whatever works,
Yeah.
especially especially when we go after 30 years old. Like, okay, man, I need something to work for
Yeah.
the next race.
Yeah, our body's not as it was as 20s.
Yeah, but yeah, chiropractic, going to a chiropractor, it has changed my life for a better, very positive. Are you training for a race? Have you signed up for any race?
Yes.
Uh-huh.
Yeah. So I know before this, we were talking about how I am a short distance runner. But I'm saying for research purposes, I did sign up for the Chevron.
Okay.
Okay, so I'm doing the Chevron in January. So I'm training for that. I have done 10Ks before. I've done 5Ks, lots of 5Ks, 10Ks. But this will be my first long endurance. So I want to be able to connect too with with my marathon patients
And that's gonna be for 2026.
for 2026. Yeah.
2026.
hmm
Yeah, you have a year to train and everything. So when you run all these 5Ks and take 10Ks, what is something that you have discovered during the race that you maybe didn't know about yourself?
So mindset, right? There's times where you really want to stop, or you have blisters on your feet, or I know that there's been times where I'm like did I get adjusted? I got adjusted last time, right? What
Yeah.
is going on? But just making sure that you push through, but also listen to your body when you want to go a little bit slower. Either way, right?
Yeah.
Maybe not stop, but slower.
Yes. Yeah, that's very true. It's a very important lesson that you learn while you're running. So we were talking about food before, going to Chinatown, and all these delicious food
Yeah.
that you can find there. Uh, the other question that I have is, can food actually improve joint health?
Yes.
Uh huh.
Yeah. So nutrition is everything. Nutrition is 80% of just a lot of your health, right? Especially if you're working towards specific health goals. So, I mean, anything that you can do to decrease inflammation. So, again, omegas are really good, but you don't have to be taking the supplements. You can have fish and eat clean. And then, specifically for runners, we want to load up on carbs sometimes, right? But the right carbs are what's important. So, making sure that we have things like barley or grains that are ancient grains. So nothing that's going to cause inflammation in your body or also cause brain fog. And there's like gliadin and all of it too. So just making sure that things are organic.
Okay, organic, going on the organic side. That's just pretty important. So you're gonna run the marathon in
Yeah.
January. Are you gonna run other races before the marathon? Uh
Yes.
huh.
I feel like I have to, right? Like you
Yeah.
have to do 10Ks. You do. There's a half marathon that a friend has been trying to get me to sign up for in summer.
Okay.
So again, I don't do well in hot weather, but I'm gonna do it.
Yeah.
So we're gonna do a half marathon before.
Okay. And how about 5Ks in case?
Yes.
Uh huh.
Yeah, yeah, yeah. I haven't signed up for them yet, but we're training towards that.
Okay. Okay. Yeah, I think it's very important, to run few races before the main race. Just to test yourself and see how your body feels. Like, okay, I need to adjust this. I
Yeah.
need to fix this. And one other thing that I like, going to a chiropractor, is that I always, if I have a race, like
Mhm.
for example, I have marathon or whatever, I always like to go to a chiropractor like maybe 2 days before the race.
Yeah.
Uh huh.
Yeah, absolutely. You want to make sure that your body is in the best possible alignment before doing all that. Because, well, you want to go before and you want to go after to fix it.
Yeah, yeah, that's true. So if runners did just one stretch, what should it be?
Oh, one
Uh
stretch.
huh.
Um, I would say probably quad stretches
What
and
stretches?
hip flexor stretches. So anything anteriorly because we do sit down a lot.
Uh huh.
And that's most of everyone's day. So a lot of hip flexors are tight,
Uh huh.
and that's one of the main things that we use as we're running, right? Hip flexors and
Uh
quads. So anything that you can do to stretch anteriorly,
huh.
beautiful.
Okay. Okay. That's pretty good. Um, this is great, doctor. All this knowledge that you're giving us today for the running community, it's very important. I'm pretty sure a lot of our listeners, a lot of our viewers are gonna be very happy that you're giving all this information.
Yeah, I hope it helps. Yeah.
If they wanna go, to where you can adjustment, how can they reach you?
So again, corrective chiropractic, only 4 to 5% of chiropractors actually do
Uh-huh.
corrective chiropractic. But where they can reach us, I work at Life Essentials Chiropractic.
Uh-huh.
So that's in Missouri City. But again, if you can find a corrective chiropractor in your area, that'd be great.
Okay, that's great. I don't think I have asked you this question, but why did you become a chiropractor? Why was your inspiration to become a chiropractor?
So I was actually president of the pre-medical society when I was in college,
Uh huh.
and I got to shadow every field.
Uh huh.
So pediatricians and surgeons, and I did labor and delivery, and I was like, that's not for me. But but my last one was actually a chiropractor, and I'm
Okay.
so glad I found them because I actually had never heard of chiropractic before then.
Mm-hmm.
So what happened was there was one chiropractor in San Marcos, Texas. I went to school at Texas State,
Okay.
and there was one chiropractor in the whole town.
Uh huh.
And I remember shadowing, and there was this man that came in with his wife and his daughter, in one hand, just being carried in. And I thought, what is this man doing here?
Yeah.
Like, he should be in the emergency room. He can't even walk. He got adjusted and he walked out.
Okay.
Like, nothing happened.
Wow.
And I said, why don't more people know about this? So I started researching chiropractors, and I started seeing just miracle after miracle. Well, it's miracle, right?
Yeah.
So, women that couldn't get pregnant were getting pregnant. People that had allergies since they were little, like their allergies were being controlled or just completely gone. So lots of things, people coming off medications that they had been in for decades. So lots of what you would call quote unquote miracles, but really it's just how the body is supposed to be, how we're supposed to be functioning. Just more people don't know about it.
Yeah.
So I thought, okay, let's go to chiropractic school. And it's so funny because at that time I couldn't even afford the adjustments from the chiropractor that I was shadowing.
Okay.
Yeah, she didn't give me a discount, but but I said, okay, well, I mean, I see it happening, so let's go to chiropractic school.
That's pretty impressive. That's pretty inspirational. So, if you would like to give a tip for someone that wants to become a chiropractor, what would you recommend them?
I would say, see what your why is, right? So a lot of people, um, a lot of people think that chiropractic is low back pain or neck pain, and of course we help a lot with that. But for me, becoming a chiropractor was about the body just functioning the best that it can, for you to think the best. Or think optimally, make sure that you don't have brain fog, or just are able to go through day to day with no interference in your body. So that was my why. But get to a good chiropractic school, get to a good principle based chiropractic school. I went to what's called Texas Chiropractic, right? And I loved my time there. I met my fiance there, right? But it was more based on, we even did flu shots and stuff like that there. So it wasn't exactly how I wanted to practice. It wasn't what I had seen in San Marcos. So I would say look for a good principle-based chiropractic school.
Okay, okay, that's a great advice right there. Now that you are in this running journey,
Yeah.
are you planning to join a run club, or just train by yourself? What's gonna be your goal to run for the marathon?
So I have a Garmin watch, and I got it specifically for running,
Okay.
right? Because I said that I was going to do the half marathon, right? So with the Garmin, it actually gives you a coach. So I'm going to use that. And I have a friend that just did the half marathon, the Chevron, in January. So we're both going to challenge each other and train together. And that's our goal. That's our plan.
That's nice. That's nice, because always it's hard when you train by yourself, and when you have
Yeah.
someone to support you, or just to train together.
Yeah.
That's a very very, very important factor that can help you go through the journey of running a marathon, or training for a marathon, because it's hard. It's very hard.
Yeah. And my fiance, I'm reeling him in
Uh-huh.
as well. So he's starting to run as well.
Have you looked for like running shoes, or have you tried different types of shoes? Have you find your right type of shoes?
Yeah,
Uh-huh.
so I went to Fleet Feet.
Uh-huh.
I've gone to Fleet Feet, and you know how they measure your feet and everything, and they have you run on the treadmill and making sure that pronation, supination. So I like that they focus on all of that.
Uh-huh.
And what I use are Hokas, and I think Brooks are really good. So those are the two
Okay.
that I use right now.
Hokas and Brooks.
Hmm.
Okay, okay. Yeah. I wear Hokas. I like that they're white.
Yes.
So one time I try Adidas and Nike, and they were a little bit, narrow.
Hmm.
And then when I also went to Fleet Feet, and they told me, this is your type of foot that you have, so this is the type of shoe that you have to wear. And I started using Hokas, and I since then I've been using Hokas, and my racing shoes I think are Brooks, but it's for the same thing, because they're
They're
wide.
wider.
Uh-huh.
And you feel like you're running on air.
Yeah.
Yeah.
uh Are you planning on buying like racing shoes or just the regular shoes?
I will be back to getting racing shoes and then breaking them in at
Uh-huh.
least a month before. Yeah, for sure. You can't do it the race day. I've learned.
Do you, yes. Do you like to run with music or without music?
I like both.
Both.
I like both. With music, if I have a good playlist going,
Uh-huh.
because I don't like to be looking at my phone. I just like to go.
Yeah.
But without music, I think you get into a meditative state too.
Yes.
You get to breathe and just hear the birds and
Uh-huh.
be able to be more free. I feel like without music.
Yeah, there is this effect that happens in your body when you're running,
Mm.
that it takes you to like a place of peace
Mm-hmm.
when you connect yourself, your uh, everything, like you connect yourself with nature, whatever you're running, and it gives you this place of peace. So there is something very holistic about running too.
Absolutely. Yeah.
Uh-huh.
So the chemicals in your body, the endorphins, the
Mhm.
dopamine, even serotonin, right? It builds up whenever you're running. So all of that. Plus going outside too, getting that vitamin D in, that
Uh-huh.
that free vitamin D,
Yeah.
right?
Yeah, everything free is great. Doctor, if you could give runners just one injury prevention tip,
Mhm.
what would it be?
One injury prevention tip. Um, get adjusted.
Yeah.
As a chiropractor, yeah, get adjusted.
Uh-huh.
Honestly, just being an athlete in general, or just doing life in general,
Mhm.
you need to get adjusted. If you can't get to a chiropractor, though, for sure, mobility before and after the adjustment,
Okay.
mobility work.
Okay, that's a great advice right there. One more thing. How can we find you on social media? How can we find you on all the socials?
On the socials.
Uh,
So I am as the Crunchy at the Crunchy Cairo on
okay.
everything: Instagram, TikTok, Facebook. Haven't gotten on X yet, but
Okay.
might start.
This year.
Yes.
Okay, that's great, doctor. Well, just want to say thank you very much for coming today to the show.
Thank you for having me.
If you would like to give, another advice or tell whatever that you want to our running community here on Running Record Podcast, you can do it, and just tell whatever you want.
Yeah. So I would say if you haven't been adjusted or you're scared to be adjusted, just go make sure that whoever is adjusting you does take x-rays or does take a full thorough exam before. An adjustment is better than no adjustment, always, right? But just making sure that your body is functioning properly, just not just running but for everything in life.
Awesome, awesome, Doctora Grecia Rojas. Thank you very much.
Muchas gracias, Lawrence.
Thank you.
The
Nos vemos.
pleasure.